Hi, everyone. Welcome back to my podcast, See the Invisible, Living with an Invisible or Rare Disease. My name is Rhonda Franny Jefferson, and thank you so much for taking some time out of your day to listen. If you've not heard any of my previous two podcasts, what I'm hoping to do is try to show some support and spread encouragement to those who are affected by an invisible or rare disease. And this not only includes those who have the illness, but also their support system, such as their family and friends, even their doctors and co-workers. Because it's not just one person who's impacted by an illness, it's many, many people around them. So I know in this past week we've celebrated Thanksgiving here in the U.S., and 2020, to say the least, has been a little tough on everybody. Now, living with an illness that could put you at risk, I know, has been even more difficult. Life on any day may throw challenges at us, but living in a world where there's a virus that seemingly is not being controlled, it causes anxiety and affects just the daily things that we can do, such as taking a quick trip to the store. It's been months and months since I've gone into a store just to look around and browse. I haven't done that since before the pandemic. My days are pretty much limited to going to doctor's appointments when necessary, maybe going to the corner store, as you would say, a store that's just right down from my house, but I know the people there and I trust that I'm safe in that store. But otherwise, I know I've had to make changes to my life. But looking back at that, I'm thankful that I'm living today, that I'm not living during the pandemic in 1918 of the Spanish influenza. There are so many things that we can do today compared to then. Today, we can get information pretty much at the click of a button. We can see areas where there's an uptick in cases. We can get information on the most recent research. And also, the technology has allowed for advances in the medication and vaccines that are being used to happen at a much quicker pace. I know myself, what has been extremely helpful too is not only technology in the medical field, but also in everyday life. If you had asked me 5 years ago would I have groceries delivered to my house, I would have said no. But when a store did start to offer that in my area shortly after the pandemic, that changed my life in a lot of ways. It was very difficult to think of how am I going to go into this store and mitigate risk when there's dozens of people that I don't know. I don't know what their procedures are and if they're following protocol. So to know that I could order something and get it delivered really helped me feel even more secure in being able to take care of my family. So there's a lot of things that I'm looking back and saying, okay, 2020's been rough, but there are things there that can help me cope. And, I'm just feeling really thankful at this time that we have this. So if you've had a chance to listen to my previous two podcasts, you may know that one of the things I want to start out with is looking at how to be your own advocate. That's one of the most important things that we can do for ourselves, but especially when you have an invisible illness or a rare disorder. The invisible illness, it is what the name implies. It's not something that anybody can see just by looking at you. Now, there's a possibility a doctor might be able to see some small signs, but they're not going to have all of your information unless you're open with them. I did look and found a couple articles about how you can best become your own health advocate, and I decided to focus on one which seemed to just hit the main points. And this came from U.S. News called 6 Ways to Be Your Own Health Advocate by Elizabeth Renter. And I'll also post a link to that in the notes to my podcast. So her first item on the list was understanding health insurance and how it works. Now, Just briefly, I was a little surprised that was number one because it's not directly dealing with your health. It's dealing with money. That's what it comes down to, is money. So that was a little disheartening, and I was surprised to see that in the number one position. What I would have thought would have been in the number one position is don't be afraid to ask questions, and that was listed as number two. I would also probably go to extend that to say don't be afraid to communicate openly with your doctor. The third item was maintain records. The fourth was review your medical bills for errors. Here we go back again to money and making sure everything's covered properly. And for us, though, as the patient, making sure that we're not overcharged. Number 5 was know when you need a second opinion. And 6 was take advantage of free preventative care. So what I'll probably do in the upcoming podcast is put number 1, understanding your health insurance and how it works, and number 4, review medical bills for errors together, as they kind of go hand in hand. But today I wanted to focus on don't be afraid to ask questions. So I know that when I go into a doctor's office, and I know many people who look at it this way too, is you're going in and seeing someone who's been trained, who has this medical knowledge that you don't have, so you're just going to defer to him or her completely. But something we need to remember and realize is the doctor is only as good as the information that we provide. So give them everything. It might be something that you're uncomfortable talking about. Everybody has something that they're not comfortable talking about with anybody at all. But if you're going to ever be open and honest completely with anybody, make sure that's with your doctor. They need all of the information to try to make a correct diagnosis and figure out how to treat you. Even if it's something trivial, it might be a piece of information that ties everything together. So just make sure that you're communicating openly, honestly, giving them all of the information that they need. And at the end of it, if they've given you a piece of information that you don't necessarily understand, ask questions. They're not going to know if you have a question unless you say something. So when you go into your doctor, don't look at it as, oh, my doctor has all of these degrees, he or she must always be right. Look at it as a partnership where you're equal, because you need to provide the information. You know you best. Nobody knows how you're feeling or what you're going through other than you. So again, especially with an invisible or a rare illness, you really need to feel free to open up. So make sure you have that rapport with your doctor. Just to kind of add there too, if you're in a situation where you're not comfortable with your doctor, call around. It's not necessarily a second opinion, but you want to make sure that you feel like you can talk to your doctor about anything. And to stay with a doctor because of convenience or because of proximity is not always the best. Staying with a doctor who you can discuss your illness with is paramount. So one of the things too that we can do when we're going into a doctor's office is make a list of questions or of items that you want to discuss. Anything from you just need to have a couple refills of a prescription to something that's really bothering you about how you've been feeling. So make sure you have everything focused and written down. Before, I used to tell myself, hey, I'll remember to ask this or I'll remember to ask that. More than once I left the doctor's office and was driving home and thought, oh, I forgot to have them refill this, or, oh, I meant to ask her about this pain that's been happening in my knee. Things like that. So now I do make a list of what I need to discuss so that it's not missed. Another important thing about that is the amount of time that doctors are now spending with their patients. The study that I was able to find and read goes back to 2007, so the numbers I know will probably be a little off, but if anything, I would think the amount of time that doctors spend with patients is now less. But in this article in Huffington Post, written by Deepak Chopra and Rudolph Tanzi, the title of that article was How to Be Your Own Medical Advocate. They did find a study that they reported on in their article that when you go to a doctor, you have about 16 minutes with that medical professional. And I'm using the term medical professional because it's 16 minutes for everything. That's the nurse who checks your blood pressure, the nurse who checks your oxygen level. All of that counts in that 16 minutes, so that by the time the actual visit began and you were able to start discussing things with your doctor, you only had about 7 minutes. That's less than a sixth of an hour. So you really have to manage your time and make sure you have the most important things covered. So if you have 3 things written down and you're only going to be able to spend about 7 minutes with your doctor, you know you have to keep on target. Another thing that honestly used to bug me in one of my doctor's offices was there was a sign that said, please, no, oh, while I'm here, I have, and then it didn't finish the quote. It was saying, don't, as the appointment is coming to an end, say, oh yeah, doc, I've had trouble with, fill in the blank. And like I said, that used to bug me. I'm thinking, but they're your doctor. What else are they there for? But then I did begin to realize, adding that extra question actually pushes back the time that another patient can spend with them. It also makes the patients wait a little longer. So over the course of a day, if everybody did that, they wouldn't be able to finish all of their patients. So I have actually had a couple of doctors give me 2 time slots. So when I called and spoke with the scheduler, whether it was the receptionist or office manager, whoever it happened to be, I explained what I needed to go over. And, at least a few times I was given 2 slots. I've even had that when I've had dental work done. Unfortunately, some of the medication I have, as well as the illness, can start to eat away at my teeth and just some problems in my mouth. So I've had to have, multiple things done at the dentist recently. But that would mean going back and forth. And I explained, is there a way that we can do this? And fewer sessions. And they were like, sure. And they booked me for a double appointment. Now that's a little different from discussing, an actual medical situation compared to having a medical procedure done or any type of procedure, in this case dental. But because I was able to express to the office manager what I really needed, he was able to do it. So when you call to schedule your appointment, if you're saying you're just calling for a cough, that's what they're going to put you in for. But if you say that you've had a cough, you're feeling more heartburn, you've had some dizziness, things like that, they may understand, okay, this might be longer. And just ask if there is a way that you might be able to get a double slot. The only downside to that is there may not always be back-to-back times open, but if you don't say anything, you really won't know if that's even an option. Going hand in hand with this is taking notes in your appointment. Even though it might only be 7 minutes with your doctor, there's usually a lot of things that my doctor and I will go over. So if you take notes, you have a record of what you talked about. That will also help you later on if you can't remember exactly something she said, or it could also help you develop more questions that you might have with the next appointment. So that's important as well. Now, lastly, I do also want to mention that doctors are there to help. So at times, even if there's something that you might have done that you don't think that they'll like, such as you haven't been keeping up with your medication, I will just be completely honest here. One time, because I'm prone to a certain infection in my legs, I've been on antibiotics quite a few times for that. And one time I had it very severely. I was on extended antibiotics, and my doctor, after seeing her for one visit, wrote me a larger prescription That way I wouldn't have to keep going back and forth to the pharmacy. Then, with my next visit, she saw everything looked good and said, okay, you don't have to take any more of the antibiotic. Well, not too long later, I didn't want to necessarily go back to the doctor or the ER. So I said, okay, I will just take this as directed. Did not work. But when I did see a doctor in the ER, I did tell him that because I knew it could impact how he read a test. I knew I had this infection coming on. The medication hadn't helped, but I also was thinking, could it have impacted my white blood cell count? So when the blood tests come back, it may not look like I have an infection. So he told me, okay, thanks for telling me, don't do that again. But he also said that he's there to help, and no matter what, whether it's anything from being there for something like I was, whether it's because of substance abuse, anything like that, it's okay because they're there to help. He was very non-judgmental, and I was very concerned. I was thinking he's going to look at me and just think, what was she thinking? But he didn't. He just explained he was there to help, and it really made me feel more comfortable, even to a point where when I had to make another trip to the ER, I saw this particular doctor and was hoping to get him again, but that didn't work out either. But it's just because that honesty, even that I gave to him by telling him what I'd done, it, to me at least, helped build a rapport. I know that he's seen hundreds and hundreds of patients since I had last been in there, but just to me, I felt more comfortable because I was, I had been honest with him in the past, and I knew how he reacted to it. The last thing I'm going to go over in being your own advocate is something that, at least in the current situation, most of us will not be able to do. The 2 articles that I mentioned did say that, if you can, if at all possible, have a friend or family member come with you. That way they're there for support. They can ask questions too if they're not sure of something the doctor said. I know that most offices are limiting their waiting room so that only patients can come in. And I've even been to one doctor where I had to wait in the car before the visit. So, again, at this point in time, it's not something that really seems as feasible as it might have been, a year ago. But hopefully, if things start to turn around, we'll be back to the time where you can have a friend or loved one as an advocate. I even know that some places offer a patient advocate because that advocate works with the medical system and they know things that we won't know. So just the biggest takeaway from this is be open with your doctor, no matter what the situation. They're someone that you should feel entirely comfortable with, so that every time you see them, you have a frank conversation with them. So with that, I am going to end the podcast today. I am just trying to look to have shorter podcast so that you get a little something out of it. You hopefully get a little bit of encouragement to go on throughout your day. Now, I am at some point in the future hoping that once I figure out systems, that I can interview some people that I know who have the invisible illnesses to spread their stories, because my story is different from yours, theirs is different from mine. No one has the exact same circumstances, so just to let people hear things from different perspectives, from not only the patient themselves, but also with family members or other support persons. So if you do have any questions, you can email me at seetheinvisible@gmail.com. I did also recently start a Facebook page called See the Invisible, if you wanted to check me out there. I am working on Instagram, but I'm not exactly sure if everything transferred over correctly when I was making some changes, so we'll see about that. But Again, thank you for taking some time to listen to me today. I really get a lot out of it too. So I hope to hear back from you in emails or comments. And thank you very, very much again for taking the time out to listen to me today. Again, my name is Rhonda Franny Jefferson. The name of the podcast is See the Invisible, Living with an Invisible or Rare Disease. And if you get a chance, like the podcast, give it a good rating or a good comment. That helps promote the podcast itself so other people can, hear what I'm trying to say and the hope that I'm trying to spread. Thank you so much. Have a good day.